Hi, I'm Celia. I'm one of the physios at my Physio SA for her, and today we're going to be talking about posture during breastfeeding. So breastfeeding can be quite a challenge, especially when you're getting started for many women. If you are lucky enough that you're able to breastfeed, there's several different things that you can be doing to make sure that you and your baby do well with your breastfeeding. The first one is making sure that you get a really good latch. That's something that can be quite difficult to establish, especially when the baby's really small. If you're having any difficulty with this, this is something to get help with really early on so that you establish good feeding habits. And to get help with that, that's something that you can see your lactation consultant with, or have a talk to your midwife or your obstetrician to ask where you should go to get help for this problem. If you're having any difficulty or pain, that's something that can really affect how well you're able to feed and how happy your baby ends up with the feed as well. The other thing that can cause is if the baby's just holding on to the end of the nipple, can cause quite a lot of pain and discomfort that can lead to cracked nipples or infections, which may develop into mastitis and quite a lot of pain for you during your feeding process. So really important to get help for this straight away. Usually with a good latch, it's not just the nipple in the mouth, the baby needs to take quite a lot of the breast tissue as well. So a good area around the breast tissue to make sure that it's not just pinching on the breast itself. To help the baby get a good latch, it's important that you've got a range of different postures that you can try so that you can work out what's going to be best for you and baby, because everyone's different, every mum's different, every baby's different, so you need to work out what's going to be best for you and then experiment with a few different positions, because you might not always be able to sit in a great supported chair if you're out visiting friends or family or having a day out. So practice and get different, comfortable in different positions as soon as you can so that you're able to head out and about with your baby and be confident that you're able to keep feeding well. So we're going to go through different positions for breastfeeding now. So the best posture you can get into is a nice supported chair, ideally with some arms on it and an upright back, so that your back's in contact with the chair, you're not trying to hold yourself upright the whole time. The first position we'll go through, usually a pillow underneath the baby is really helpful so that you're not trying to hold the baby the whole time. So that's why I've got a pillow on my lap here. So the first position we've got the baby into here is the cradle position. So you're holding the baby with the same arm at the side of the breast that you're feeding off. And the baby should just be able to come naturally to the breast. You're not having to push the baby into it or lift the baby up towards your breast. If you have really large breasts, you might need to recline back slightly and bring the baby away so that the breast isn't pushing down onto the baby and it's having trouble breathing while you're feeding as well. So that's your cradle position there. So then moving into our second position, coming upright, having the baby holding with the opposite arm to the breast you're feeding on, and this would allow you to position the breast more, maybe if you're having difficulty getting that good latch to start with. So this is your cross cradle position. The other position you can move into in sitting is your football hold, and that would be holding the baby with the baby coming beside you. And this position is really important to have support under the arms, so you might need to move the pillow underneath so that you're not having to again hold the weight of your baby and lifting up as you're doing the feed. So those are the sitting positions you can go through. With all of these positions, it's really important once you've achieved a good latch with the baby to make sure that you yourself are in good posture and you're not craning down and looking at your baby the whole time as much as you might want to. So for that, you want to make sure that you're sitting nice and relaxed against the back of the seat, your shoulders are dropped down and your neck's nice and long. If you're leaning forward like this the whole time, it creates a lot of strain through the back and the neck and can create some pain and stiffness through those areas, which if you're repeating your breastfeeding over and over and over again during the day and the night, you can imagine you can get quite sore through those areas of your back. So really important to watch out for yourself as well as your baby once you've established a really good feeding routine. The other thing that you can do is optimise your time while you are feeding and try and work in some of those pelvic floor exercises that you've been practicing. It's a great time because you're just sitting there, you've got time. Once the baby's feeding well, just try and do some of your exercises that you've been taught while you've been in hospital, or if you're not sure how to do them, see a physio to teach you how to do the right exercises so that you can get that pelvic floor nice and strong again after your pregnancy and your delivery. Okay, so I hope that was all helpful for you today. Remember, if you're having any issues with your feeding, see a lactation consultant, or if you're having any difficulties or pain with your feeding through your neck or your back or any other areas of your body, come and see us at My Physio SA and we can help you out and make sure breastfeeding is a positive experience for you and your baby.